Welcome to the Western Michigan University College of Health and Human Services, where excellence and innovation in teaching, learning, research, clinical practice, and community service come together to put our graduates ahead of the curve in their professions. U.S. News & World Report ranks our social work masters in the top 66 and 5 of our graduate programs among the top 50 of their kind in the nation. Those are the doctoral degree in audiology and master's degrees in occupational therapy, physician assistant, speech-language pathology, and counseling rehabilitation. These and all of our outstanding academic programs employ advanced teaching and learning methods. Integrate didactic learning with research and the direct application of both in evidence-based clinical practice. And incorporate interdisciplinary knowledge and interprofessional roles in collaborations that prepare our graduates to work effectively as team members in a care setting. This unique educational model enhances our graduates' professional success and the quality of care they provide.
We do a variety of different activities in our labs and with our mannequins. We're able to have the students involved in simulations and role-playing in order to have them practice nursing skills that will be needed in the real world. We can do simple role-playing as well as low-fidelity or high-fidelity simulations with standardized patients or mannequins. The mannequins are great because they can practice certain skills such as changing dressings or starting IVs. They can perform trach care, and they can even catheterize the mannequins. We have high-fidelity mannequins that breathe. They have several different lung sounds. We can even make the lips turn blue or make the baby mannequin have a seizure. These mannequins allow the students to practice their assessment skills, and we can change the settings on the mannequins to make them do different things during the simulation, depending on what the nursing students do. This keeps the simulation interactive. It encourages the students to critically think about their nursing interventions and their decisions. It really allows the simulation to be as close to real-life experience as possible.
Students often report that they are amazed at all of the different things that nurses have to pay attention to. Doing their assessment, administering their medications safely, talking to patients and families, providing education, and surveying the environment that they're working in. And they are doing this all without having a faculty member that's right by their side like they would normally have in a traditional clinical setting. Students also have an increase in their confidence levels as they go through the simulations throughout the semester, and they also are able to identify what their learning needs are so that they can practice those certain skills or activities that they did not perform well on in the simulation.
I think the fact that the clinical faculty here and our teachers are so experienced, I think that helps in how they explain things and how we, specifically myself, learn. I like explanations, and I feel like our professors are able to do that for us in a different way. It's not just PowerPoints. They sometimes have props, or just their experiences they're able to use those to explain to us.
My stomach hurts so bad.
Are you more comfortable laying flat?
My stomach hurts so bad though.
Okay.
Yeah.
What is that?
When students enroll in the AUD program, the audiology program, they need to learn a series of knowledge and skills in order to enter into independent practice as an audiologist. So at the college level, the students have their coursework and they are engaged in didactic learning. And in the clinic, they learn their skills. They learn the skills that they need to practice as a clinical audiologist.
Well, I think as a student, working in the clinic is a really important part of the educational process. It's really helpful and also really exciting to be able to apply what you're learning in your coursework to what you're actually doing in the clinic with patients. And as far as the research goes, it's just really important in this field. Everything we do needs to be based in research and evidence-based. So being involved in the research process really allows you to apply the importance of evidence-based practice to what you're doing in the clinic.
Corn.
Corn.
Corn. What sound does that?
C.
Yeah, what sound does it make? Perfect.
In 1997, I came to Western Michigan as a professor and with a goal to start a trauma center for kids. I had spent 17 years in Child Protective Services and recognized that our kids in that system were not receiving the services they needed because primarily people didn't understand what trauma was doing to them, both physiologically as well as relationally and behaviorally. And so with that kind of goal, I met up with a pediatrician, a clinical social worker, an OT professor, and a speech and language, who together we brought 125 years of experience working with maltreated children. And so we envisioned this center to be able to help judges, caseworkers, doctors know what the impact of trauma was to kids' brains.
The value of providing an opportunity for assessment in a university setting like CTech is that we really can provide to multiple disciplines and not only an understanding of trauma, but an understanding of what they can do in their separate professions when they go out in the field to ask the right questions, to see kids differently, and to assess kids in a way that respects that they may have experienced adults as threatening or as judgmental.
At CTech, we have different professionals that are there together, so you all work together to gain the information, to share your knowledge that you learn about each child. So the child will see the doctor and the doctor will give his input. There are some social workers that'll come in and just analyze their social situation and maybe how they're getting along with others at school or whoever they converse with. And then sometimes there's nursing students or occupational therapy students like myself. So it's just a great interdisciplinary type setting for, I think, anybody to learn.
I feel like the transdisciplinary approach at CTech has helped to prepare me for, I guess a broader scope and teams later on in my career. I think that being able to openly sit with other disciplines and listen to what they have to say and where their expertise is and try and integrate that with what you know and what you bring to the table is invaluable. And to take that beyond here and to apply that into a professional field is just, it's a gift to wherever you go.
These are just a few examples of the exceptional education that students experience at the Western Michigan University College of Health and Human Services. We trust you have enjoyed this visit and invite you to visit anytime to learn more as we prepare professionals today to transform healthcare and human services tomorrow.